I am Retalako Afu, a physician specialist and an endocrinology fellow in training at Kolebu Teaching Hospital. I am also a student of the South Wales Postgraduate Diploma in Endocrinology. Today, I have a section of my patients and I'm going to take them through a general overview of endocrine cancers. The endocrine system is made up of a network of glands and organs that produce hormones that are used for essential processes in our body, such as reproduction, menstruation, and digestion, just to mention a few. The endocrine system is made up of organs such as the pituitary gland, which is found at the base of the brain, the thyroid gland, which is found at the anterior part of our neck, the parathyroid glands that are found just above and below the thyroid gland, the pancreas, which is found in the abdomen, the adrenal gland, which are on top of the kidneys, and the ovaries and testes, just to mention a few of the organs. When cells of the endocrine system grow abnormally, they form what we call tumor. The tumor can be described as benign or malignant. Benign means that they don't have the ability to spread to other parts of the body. Malignant ones can spread to other parts of the body through the blood or lymph nodes. And these malignant ones are the ones we refer to as cancers. And today our focus will be on these cancers. What causes these cancers? A lot of times we may not know. But what we know is that sometimes there are abnormal changes in our genes, what we call mutations, and they can lead to cancers. The cancer can be described as sporadic, which means that when it's found in one person, it's not likely that another member of his family will be diagnosed with the same condition. It can also be described as familial, which means that when the cancer is diagnosed in a patient, his close relatives can also have the same condition. For this reason, for familial cancers, we do what we call genetic screening. And if a relative is also found to have such an abnormality, then the person will be followed up so that just in case the person is developing the cancer, it can be found early and then treated. Endocrine cancers can be described as functional or non-functional. Functional means that they produce excessive hormones. For instance, a glucagonoma, which produces excess of glucagon. Glucagon is the hormone that ensures that our body does not have low sugars. And so a person with excess of glucagon will present with diabetes and other symptoms. Also, if a person has testicular cancer, which is producing estrogen, then a man will present with breast enlargement or what we call gynecomastia, and also shrinking or atrophy of the testes. Non-functional tumors, on the other hand, do not produce any hormones. They enlarge and compress on structures that are surrounding them. For instance, if a pituitary tumor is enlarging, it can lead to headaches, visual changes, and also vomiting. The vomiting is usually due to raised intracranial pressure. There is also a system called neuroendocrine system, which produces cancers that are called neuroendocrine cancers, and they form part of the endocrine cancers. These cancers usually present with syndromes. Example, carcinoid syndrome, and they present with a group of symptoms. Example, diarrhea, that is passage of watery stools, flushing, that is burning sensation on the face, and also palpitations, which is a feeling that the heart is beating fast. To diagnose these cancers, we do what we call biochemical testing. In biochemical testing, we test for levels of hormones that we suspect are in excess. For instance, we can check the blood level of glucagon in a glucagonoma. We can also do what we call functional testing, in which we try to simulate certain processes that happen normally in the body. For instance, we know that glucagon levels will go down when you in the presence of a chemical we call secretin. And so such a patient can be injected with secretin and tested again to see whether the glucagon levels have gone low. If the glucagon levels are still high, then we suspect that this patient can have a glucagonoma. Subsequently, we can also do what we call imaging, trying to locate where the tumor is. The imaging techniques that we use can include ultrasound, CT scan, MRI, all in an attempt to localize the tumor. We can also do functional imaging, which include techniques such as somatostatin receptor scintigraphy. In this sense, certain chemicals are injected to the patient, and the cells of the tumor pick up these chemicals. So when the scan is done, the scan is able to locate where the tumor cells are. When a patient has been diagnosed and the tumor has been found, there are techniques that we use to treat these patients. We can do what we call a curative surgery, in which the whole of the cancer is taken out of the system without any remnants. Also, if some of the tumor has spread to other parts of the body, let's say in the liver, part of the liver can also be taken out, all in an attempt to ensure that the patient has been cured. We can also do what we call debulking surgery. That means that the cancer cannot be cured, but we want to reduce the cancer load so that we slow down the spread to other parts of the body. After debulking surgery, we can do what we call chemotherapy, in which the patient is injected with chemicals, and these chemicals have the ability to kill the cells that have spread to other parts of the body. Sometimes, because these tumors spread through blood, we can do what we call chemoembolization, where we block blood vessels through which these cells would have spread. We can also do what we call radiotherapy, and the purpose of this is also to shrink the tumor and also to control spread to other parts of the body. After these techniques, then the patient is followed up periodically. Various investigations are done, first of all, to ensure that the person has got a cure. In those people who did not get a cure, we try to determine whether there is persistence or there is recurrence. Recurrence means the person was cured, but unfortunately tumor has come back again. And in so doing, we are able to control the spread of this cancer. The prognosis of endocrine cancers, that's the outcome, are generally good if they are found early, but they can also be bad if the tumor is found in an advanced stage where it cannot be cured. Thank you.